Welcome to today's National Neonatal POCUS Collaborative webinar. I'm Fatima Iskander-Afshari, and I'll be your moderator today. Before we start, just some general housekeeping items to make note of. The chat is disabled for the audience, but the moderators may send out general announcements via the chat. Please use the Q&A feature to post questions. There will be a Q&A panel session after a featured presentation, and this webinar is being recorded and will be uploaded to the collaborative website, neopocuscollab.com. Now on to our main talk. It is my pleasure to introduce Dr. Abhilash Koratala. Dr. Koratala is a nephrologist, intensivist, and associate professor at the Medical College of Wisconsin. He is internationally recognized for his expertise in point-of-care ultrasonography, with a particular focus on Doppler-based hemodynamic assessment. Dr. Koratala educates a global audience of over 78,000 learners through his educational platform on social media. His website, nephropocus.com, received the 2020 American Society of Nephrology Innovations in Kidney Education Award. He has authored more than 250 peer-reviewed publications with a primary focus on POCUS, while spanning the broader field of nephrology. Dr. Koratala, please take it away.
Hi, thank you so much for the kind introduction and for having me here today. Let me just share my screen. Okay. I hope you're able to see the full screen. The goal of my talk is to just talk about my social media journey. Like when you asked me to talk about social media and address neonatal audience, I really didn't know anything about neonatal POCUS. So because I obviously never scanned a neonate. And even like giving a talk on social media is kind of new for me because I have never done that. So I thought it's a good way of reflecting on my journey, how I did it, why I did it, and what are some positive aspects that I saw, and what are some potential risks of social media based education. So going back to the origins of me being on social media and sharing POCUS content. Initially, some time ago, I was a young nephrologist or young nephrology fellow. I just wanted to do something good. And I was really intrigued by how emergency medicine physicians use point of care ultrasound to do to make rapid diagnosis at the bedside. And by the time they call nephrology and they say hydronephrosis is already excluded because they have performed POCUS, or they tell you the patient is fluid overloaded because they have looked at the IVC or they have looked at the lungs. So that really interested me at that time, because nephrologists were not aware of POCUS, not leave alone like not doing POCUS, and POCUS was pretty much a foreign term or something that's never heard of. So I initially did some brief rotations with emergency medicine physicians and learned the basics of point of care ultrasound, did some kidney ultrasound course and so on. Eventually, I spent a lot more time into this because there was really nothing specifically organized for nephrology. So it was all for either emergency medicine physicians or some courses tailored to critical care and some internal medicine. So I spent at least a good 1 year attending some courses and even shadowing sonographers at our institution to build my skills. Um, since I was the only one doing point of care ultrasound in nephrology, it got me a quick recognition within the division. I mean, I have a patient with AKI and I go with the ultrasound probe and scan their kidneys. And people are like, you're a nephrologist, and how do you even scan the kidneys? Or for that matter, like scan anything, because we were not even putting dialysis catheters at that time. Dialysis catheters are still being put by either critical care physicians or interventional radiology. And so if I go and scan a patient and find B lines in the lung, uh, the the hospitalist or other nephrologist taking care of the patient is like, I mean, I have no idea what this B lines means. This guy is saying lungs have some water, but I can't trust him because I don't know what that is. So I'll get a chest X-ray. So that was a kind of response initially. But regardless of that, it gave me quick recognition within the division and within the Department of Medicine. Um, and so I thought like this is such a useful skill and I need to find a way to get it in front of more people. Initially, I started by teaching medical students and residents rotating with nephrology as well as nephrology fellows. I was fortunate to have a division chief who bought me a machine to do both educational scans and to start billing for the scans. And then, I mean, when you're teaching people, you need to have some image repository, right? So you need to show them what's normal, what's abnormal. Normal, you can show them on healthy models, but abnormal images, if I rely only on my images or the images that I borrowed from emergency medicine colleagues, it's still a smaller repository. So I was looking for online resources where I can find POCUS related content. That's when I started uh, exploring Twitter and what we can do about it. Initially, my I just had my personal handle, uh, and even now I have it, but like there isn't much going on, and I don't have a lot of followers. But still, at that time, I started posting focus pearls here and there on my personal handle. But as the educational conversations grew, I realized that meaningful focus education can be an occasional hobby. It needs structure, continuity, and ownership. So that's when I created Nephropy handle. That was a way of formalizing commitment to focus education. So if you have a handle that suggests what you are passionate about, I think that will eventually reach more people and attract more people or like-minded people. How it evolved, I mean, it was not just me teaching. I mean, I used to share some interesting cases or images that I'm not completely sure about to ask colleagues their opinions. Obviously, de-identified images. Um, but it was not just me teaching, uh, and it was a tremendous learning opportunity for me because at least at that time in around 2018 2020 time, there were a lot of educators from different specialties including emergency medicine, internal medicine, critical care, anesthesia, everybody sharing their images and cases. That way I was able to train my eye to different pathologies. As you know, focus image acquisition and image interpretation remain fairly same throughout all the specialties. It's just the clinical integration portion and what are the relevant pathologies that we commonly see in day-to-day practice. Those are the things that differ among specialties. So, and image interpretation is all about training your eye and seeing as many pathologic images as possible. And that's where Twitter really helped me. And I mean, like looking at pneumothorax or tamponade, those things I do not commonly see, or for that matter, like musculoskeletal ultrasound when anesthesiologist posts some blocks or something. And all these things I got to train my eyes because I was on Twitter, and I was able to use those images to teach my fellows and residents too. And and also at that time, fortunately, there was strong nephrology social media presence, and there was even a 1 year internship in social media that a group of nephrologists were doing they were from different institutions and even from different countries, including Canada, um, and Duke University and a lot more. So they were in the process of building a group or a community on social media and teaching people what to do, what not to do, and what comes across as good social media practice and what sort of tweets or social media content can be risky for your career and so on. So that internship also helped me. It was not it was nothing related to POCUS, but at least it gave me a community and it gave me a stage to exchange ideas and get some education on good practices. And then I started writing blog posts for Renal Fellow Network, because Renal Fellow Network was another blog that partnered with American Society of Nephrology, that was also established by the same nephrology group. And I started writing POCUS posts for them. And it got pretty good recognition fast. And eventually my skills grew. I just started with kidney ultrasound and some IVC and lung, um, but being on social media, interacting with people who think critically and in a physiology centered way, I improved my skills. I expanded my skill sets to other organs such as Doppler echocardiography, and more importantly, VEXUS, which is venous excess ultrasound, that's using Doppler ultrasound to assess venous congestion in cardiorenal patients, or any fluid overloaded or pressure overloaded patients. That has gained a lot of attention these days, and I'm considered one of the experts in that, because just because I'm an early adopter of this, and I got to adopt this skill early, even before a lot of people heard about this term Rexus, just because I was on Twitter, and I felt it was very closely related to nephrology, because we commonly deal with kidney disease in conjunction with other organ abnormalities such as cardiorenal, and I really found that to be very useful in my practice. And because, like initially I said, I attended a lot of courses, right? Intended for various specialists. I even attended courses for radiology technicians, where they taught Doppler ultrasound. So having uh, good Doppler basics really helped me understand the nuances of interpretation and misinterpretation involved in Vexus. So basically, social media helped me widen my focus skill set. And then I realized that I mean, Twitter was great, and I'm getting recognition. I'm able to learn a lot of things. Um, but the posts are short-lived. I share an image today, and it gets circulated for a couple of days, and it dies. Then in 2019, I started nepropocus.com. My main idea was just as a repository of all the good images I share on Twitter. I just wanted to put those short cases in one place, especially because at that time, emergency medicine had a lot of online resources, but there wasn't really nothing um, for internal medicine or nephrology. So I thought that would be a useful addition. And as I expected, it did really turn out to be a useful endeavor. And a lot of people started learning from propocus.com. And eventually, uh, even I got um, the social media project of the year award by NFJC community. So basically, it gained wider attention, not only among nephrologists but also other people. Um, and yeah, and then like I wanted to do something more. Um, I mean, in nephrology, POCUS is gaining popularity. Now people are more and more recognizing that there is more focus in nephrology beyond kidney or vascular access assessment. But POCUS used to be under the umbrella of interventional nephrology for a long time. But unfortunately, the Interventional Nephrology Association was more focused on vascular access interventions than promoting multi-organ focus. And as you know, like American College of Emergency Medicine um, recommendations say, like when granting focus privileges uh, for a person who is doing focus in a hospital, the hospital credentialing committees should take into consideration specialty specific guidelines. At that time, there was no specialty specific guidelines beyond kidney ultrasound and vascular access ultrasound. So I thought we should develop something, and I grouped together like-minded people from different countries, and I started this. It is not really a organization, but more like a association of like-minded people. Like I said, it's called International Alliance for Focus in Nephrology. So we sat together and wrote a position statement on what we thought the scope of nephrologist performed practice should be, and how many minimum number of scans you have to do for attaining basic level of competency and so on. So basically, my thought process has evolved, and I would definitely give some credit to social media presence and interacting with multiple people. Basically, it's a way of interacting with different people and getting ideas, um, which normally, like without social media, for example, 10 years ago, the only way you can um, get this sort of collaboration would be like when you go to conferences, you meet different people, and also like you have to be a little bit extrovert and interact and proactively interact with all these people. But if you're a little bit introverted person, you probably won't gain much even by attending conferences. But social media, if you have that skill, you can easily uh, um, uh, present yourself and people recognize you. And yeah, we put this position statement. And also on social media, I initially created this logo, NephroFocus logo, just for fun and something simple for instant recognition. When I share an image, I just wanted to know that I have done it. I have spent some time creating those annotations and educational text and so on. And when it appeared on, for example, cardiac images, it quietly conveyed that focus in nephrology was not limited to kidney, but it's about physiology and hemodynamics more broadly. Over time, it started being a logo, and as the content circulated, people from different specialties began recognizing it. And that's when I realized it has evolved into a brand beyond any single institution. I mean, now I can be Abhilash from Medical College of Wisconsin, or maybe Abhilash from University of Florida. More than that, what matters is I'm NephroFocus. I'm the creator of NephroFocus. That matters more now, irrespective of which institution I am in. So I think that um, I mean, not to blame any institution, but in general, there can always be change in the way institutions look at your work, depending upon your leadership, and a lot of changes happen on a yearly basis. So, what if you're so proud to be from your institution, but what if you have to change institutions? You can lose all that credibility just because you lost institution. So, I think that's where branding really helps. And then eventually I started putting this logo on everywhere. I'm on my scrubs. This photograph with my co-director at American Society of Nephrology POCUS courses. Um, this person wearing Nephro POCUS logo T-shirt is the chair of American Society of Regional Anesthesia POCUS courses, Dr. Kalagari, and uh, this gentleman where I'm giving my mug with Nephro POCUS logo is the um, editor-in-chief of POCUS Journal, Dr. Gallen from New York. The thing is, all these things are done for fun, and I don't charge any money. I don't sell these products. I don't make any money. I spend my money, but it's fun, and it's a way of um, interacting and making connections from different specialties, um, and which is really important for growth in POCUS. Um, and coming to the social media again, like when sharing something on social media, the core message or the core educational point stays constant. If I want to share something about differentiating IVC and aorta, the message is constant. But each social media platform demands a different way of packaging that message. So how you package and deliver that the same content differs among social media platforms. Um, there are several platforms, right? X, previously known as Twitter, Instagram, YouTube, TikTok, Blue Sky, LinkedIn, and a lot of them that I even don't know some of them. And uh, in general, in my biased opinion, I think Twitter offers a very good platform for sharing focus content. I'll show you some illustrations why. And also in general, focus media education sorry focus on focus education on social media is more edutainment. It's not just education, but it's a fine balance between education and entertainment. If you cannot deliver educational content in an entertaining manner, people won't bother. I mean, already the attention span for social media users is pretty low, and if you share a busy slide with like 100 words, nobody's going to read that. And on the spectrum, I have deliberately stayed closer to education component, mainly peer-to-peer education, and some people do more patient-centered education, and some other social media content creators lean more towards entertainment, such as medical comedy, like Glaucom Flecken, and all these famous guys. And different people have different choices and different goals. But the ultimate goal is to disseminate information and do that responsibly. And ultrasound learning has several components, right? Like indication, acquisition, image interpretation, and medical decision making. Uh, Social media helps most with image interpretation because, irrespective of the specialty that is sharing this content, interpretation remains the same, and indication and medical decision making differ depending on the specialty. But still, like Twitter still allows dialogue between different people, and that way you can learn a piece of all these aspects. For example, I share quizzes on Twitter. On this left image, I'm annotating abdominal anatomy, gallbladder, aorta, left renal vein, and um, um, portal vein, and all these things. And I'm expecting people will reply to that, saying what these 1, 2, 3, 4 denote. And here I'm using the actual poll to get a sense of how many people correctly answer this and how many people think it's something else. For example, in this crab view obtained from suprasternal window, I mean, only 62% of the people recognized that this image is obtained from the suprasternal cardiac window, which is less commonly used in adults. So that way, it's a good opportunity to educate them and get a sense of where people do mistakes. And whenever I do a quiz, I always try to do a follow up. Like if I do a quiz, I next day or few hours later, I tweet annotated image showing the anatomy. And because I believe like POCUS is nothing but anatomy and common sense. If you don't understand anatomy, you don't understand POCUS. So that's why my quizzes are more pointing towards learning anatomy. And here I'm trying to um, uh, poll, I mean, showing an image of aorta and asking whether it's aorta or IVC. And the next day, I tweet some anatomic illustrations conveying the actual anatomy. And here I'm showing some comparison between ultrasound images and it's fun metaphors comparing them with animals or other inanimate objects that we see in day-to-day life. It's a good memory adjunct, yeah, as long as you choose them carefully, right? For example, here, this inferior vena cava, dilated inferior vena cava with hepatic veins, this is considered bunny head sign. Previously, they used to call it Playboy bunny sign, but some people found Playboy to be offensive because of the magazine and all the other political aspects. So you have to be considerate um, and try not to offend anybody, basically, as much as possible when doing such comparisons. And Twitter also allows you to do threads, which are called tutorials. Sometimes you can't convey entire thing in one image or one tweet, for example. Then on the left, I'm doing a tutorial on vexus, um, or color Doppler basics. So basically, starting with how color Doppler works, how spectral Doppler works, then how different venous waveforms look like, and how do their abnormal counterparts looks like. I can't do all that in a single tweet. So it's a thread of different tweets, and it can be very educational that way. And you can also share short videos on Twitter, like image acquisition pearls, and you can also share the latest studies and generate some post-publication peer review, because they generate some discussion among different specialties, and it's a good way for you to do essentially like an online journal club, and see if you can use the data from that study in your practice or not. And even if you don't do any journal club sort of thing, it's just a way of keeping abreast of newer literature. And some of the studies I wouldn't even know they existed if somebody hasn't shared that on social media. That's about Twitter. So you have a lot of ways of delivering content. And Instagram is more visual, right? I mean, Focus is visual, so it fits Instagram, but Instagram tends to reward more attention grabbing visuals than more detailed teaching or nuance. So it's good for colorful illustrations, unusual pathologies, 1 minute reels on image acquisition pearls. But in general, it's not a great platform if you want to have a back and forth discussion or share a little more information. So here, this illustration got like 1,200 likes, and this unusual carotid dissection got like 2,500 likes. But if I share very useful information on how to do focus in cirrhosis, including cardiac ultrasound, IVC, internal jugular vein, lung ultrasound, and all these things, it's a very good algorithm. It got only 195 likes. And I did this visual abstract on um, the impact of focus on radiology and echocardiography services, and it barely got like 60 like 60 68 likes. So it's not about the dense information, even if it's colorful. Instagram is about instant gratification and visual appeal. And some people, like, even if I write like a couple of sentences on like what the above image conveys, people don't even have patience to read that. They just comment a totally different thing in the comment section. So we should know like what platform you're using and what content you are delivering. And YouTube is a good way to um, share a little bit longer videos on image acquisition, for example, and um, and blogs. I mean, on nephrofocus.com, I share mini case reports, infographics, quizzes, and even guidance on developing focus programs at an institution level. So it's basically an outlet to share my experience and more tailored to nephrology and internal medicine. And there is no other platform that does it. So, like I said, I mean, there are several resources for emergency medicine, some resources for critical care, but nothing really tailored to IM and nephrology that much. So I think that the website fills that void. Similarly, if you do something for neonatal focus, and when there is really nothing out there, it tries to address that void. And basically, if you fill a void, that that resource is likely going to get more recognition than you just add 1 to 100 existing resources. Um, and also, the website can also be an emotional outlet. For example, my article didn't get accepted in a journal because the reviewers didn't know what they were looking at, or um, or or sometimes the authors I mean, some different, say for example, in cardiorenal um, papers, they do not acknowledge focus like they should. So when I'm frustrated, it's a good outlet to vent my feelings too. So and that way more people can see if they share your feelings. And career benefits. I mean, you can use social media as a research tool. For example, I published these papers on using Twitter polls as the first one is about sending out some polls on focus program development, and different people from different specialties answer those polls. So how we can adapt that to nephrology, that was the theme of that. And the second one is like I looked at the all the focus posts that I tweeted over 1 year, and saw where like which learning objective uh, a lot of users are making mistakes. So that way I know like when developing focus curriculum or when developing quizzes later, and where to focus on where people are likely to do mistakes. So that sort of useful information I got from this poll, and it's a publication. That's a good thing. And if you share your research work on social media, that's likely to get more citations, because as more people share, more people look at your work, and if they find it relevant to their work, they are likely to cite. Um, and for example, this is just a review article that I wrote, got Best Review Paper Award because a lot of people shared this, and Altmetric score went up to 169, and it actually improved the impact factor of that journal. That powerful it was in getting the number of citations, and social media presence and sharing content also got me recognition. I mean, recognition among different specialties. I gave talk at different institutions and for different specialties. For example, this Mayo Clinic nephrology visiting professor talk, American Institute of Ultrasound in Medicine, Emergency Medicine. I have given 155 invited talks in the last 5 years, and mostly because of social media presence and the recognition it got me. I'm not saying just because you're on social media and tweet occasional uh, POCUS images, you would get that recognition. But it's a way of, like, there are a lot of people among junior faculty. They work very hard, but they don't get the deserved attention or recognition. I think if you use it properly, social media can shed some light on what you do, and your social media activities may even qualify if you are able to show some objectivity to it, and it depends upon how you write your personal statement in the promotion packet. It might even be helpful for academic promotion. And beyond objective benefits, there are personal satisfaction related things also. I mean, the satisfaction that you are having a lasting impact on the field is immeasurable, and it keeps you going. For example, these guys in some Italian conference, like putting up my photograph and talking about the focus work and stuff. And this is a European Renal Association conference, shows my Twitter handle. So it shows that you have a lasting impact on the field, and you can even influence people, right? So this example, for example, here this is the established nephrologist and normally, like, older people or like more experienced people think like, why should I learn focus now, my career is almost at the end and all that, I'm very well established. But says that I'm 50 years old, but this learning focus is so much fun and gratifying, and thanks for inspiring. And that's really heartwarming to hear. There are a lot of cases like this. So basically, it's about making an impact on the field, and consistency is the key. Like, if you share one focus image today and you come back to Twitter a month later, it's probably not going to be useful. And finally, the risky side. I think we have 5 more minutes. So um, I mean, just be vigilant about what we share on social media. For example, I mean, these are all made up cases, but inspired from real life. These are not real people. So Emily here says, excited to share our new case report on pericardial effusion. And David comes and says, sarcastically says, oh, wow, groundbreaking, groundbreaking. We see this every day. Honestly, I can't believe journals still take these things, but sure, congrats. And there is no need to be sarcastic like that, right? Emily might be an early career researcher or a fellow or a resident, and she is genuinely happy that her work got published. And writing case reports is generally a first step in generating interest towards scholarly activity. And if you can be supportive to your colleagues. Don't if you don't want to be, just don't say anything. Even that helps. And here James says, we saw this IVC tumor thrombus from renal cell carcinoma, and the patient did not survive. He shares a Twitter with IVC thrombus. And Angela comes and says, oof, tragic, but wow, this view is gorgeous, with those heart signs, and screenshotting for later. Lol. I mean, this lol thing. I mean, I know some people don't mean it. I mean, I don't know if Angela meant LOL is like learning out loud. I don't know, but anyways, for most people, it's laughing out loud, right? There is When the patient dies, there is nothing for you to laugh out loud, and some people just casually use these acronyms without any context. So just be, again, like, be vigilant, and be watchful and mindful of what you're saying on social media. Michael, who is a nephrologist, says, hey, I'm a nephrologist. I can't believe I actually managed to get all the basic echo views after today's POCUS workshop. He's genuinely happy that he has never seen a beating heart. I mean, he never scanned a beating heart himself. So he was genuinely happy. And Raj, who is a cardiologist, says, oh, classic. Non-cardiologists do a couple of half-baked scans and suddenly think they have mastered echocardiography. Again, there is no need to be rude. I mean, you're a cardiologist, you're an expert in echocardiography. So if possible, try to help us by correcting our image acquisition or correcting our interpretation, or giving some image integration tips, but don't be rude and unhelpful, basically. And here is Priya, who says, I saw a 37-year-old Korean guy with shortness of breath today. And guess what POCUS showed? She is showing some B lines. So what's the problem here? Like there is really no need to say the exact age or ethnicity or even gender of this person if you just want to convey the image of B lines. So be mindful of what you're sharing. It might not be actually identifiable information. You might not be sharing medical record number, but and also like today, like you don't have to say like when you saw that patient. So that makes it partially identifiable information, and really it's not contributing to learning either. And Emily comes and says, "Oh, here is a fascinating POCUS case. I found a pleural effusion. What's the problem here? There is a date on this image, and there is patient's name, Mr. Nephropocus. He gets offended if he knows this image is shared, especially without his permission. And even Nephropocus's medical record number is there and location. That's a big no-no, and you can even lose your job for doing that." And here the Instagrammer medical student, John, here says, the patient's whining non-stop and wish me luck, this one hasn't stopped. So that's a sarcastic comment about patient. And I would say it's better not to pull up your camera in patient care areas as much as possible. And sometimes social media propagates myths. For example, kidneys like it wet, heart likes it dry, like propagating myths like the kidneys always benefit from IV fluids. And people believe such things because cardiology, nephrology feuds get a lot of attention on social media. And from that, the key takeaway, which is wrong, but take people think that you need to give fluids for AKI, even if it occurs in the setting of cardiorenal syndrome, which is absolutely wrong and nonsense. And people don't even recognize that there is something called congestive nephropathy or fluid overload related AKI. So I wrote an editorial with some of the friends saying, I mean, point of care ultrasound or punchlines, and we should rethink how we are um, um, conveying this educational via social media. We can be humorous, but there is no reason to propagate myths. Other downside is that like social media is not a textbook. You're sharing fragmented information, and unlike textbook where you have one by one chapters organized and you won't miss important pathology, relying on social media alone, you can definitely miss significant pathology, or actually because social media catches your eye when the pathology is more drastic, such as the carotid dissection I've shown you. I never saw carotid dissection myself in real life, so it will take away your interest from more common, more useful day-to-day aspects to less common aspects of POCUS. And delayed or absent peer review, because Dr. Smith here does POCUS in his clinic and says, I saw a patient with deranged LFTs, and he found this, and he thinks this is complex ascites and sends the patient to GI clinic. But what's the problem here? So this is actually wrong. This is the abdominal subxiphoid view showing inferior vena cava short axis, and all this is the right pleural effusion with the lung floating. This is not ascites. If at all he would refer the patient to some specialty, it must be pulmonary or interventional radiology to get rid of that, not GI. So he actually delayed the care. So, I mean, the delay has already happened. Hopefully, somebody told him that he did something wrong. But the point is, you get too excited. You want to do POCUS before you learn. So that also a downside of social media. Just and finally, I mean, social media is has its negative side. It's not about education, and your followers they are more likely to, especially if you have a handle like NephroPocus or NeoPocus. I mean, it's likely that most of your followers are interested in what you share, the specific content, and most likely they are medical professionals. But it's not restricted to medical professionals, and also social media does this algorithm-driven conditioning. So, for example, if you for whatever reason you hit some politically motivated post on something, like for example you randomly click something, a post that shows some dislike towards a particular ethnicity, and you keep getting the same thing every day, and over a period of time you might actually think whatever they're showing on social media is actually true. I mean, as physicians, we are people with presumably high IQ, and we are supposed to navigate and use your judgment, but sometimes this algorithm driven conditioning will cloud our judgment. The road ahead, As we wrap up, I just want to leave you with four essentials that will guide our work moving forward. First one is collaboration. None of this happens in silos, right? The more we share experience, the stronger the outcome is. And second is content strategy, being intentional about what we create and how we deliver it. Depending on the platform, will shape the way people engage with our work and how we gain recognition. And community building, growing a network that feels supported, included, and invested in collaboration with multiple specialties is the best way to, to at least like if we grow more people, more build a community of focus educators, then that will reduce the noise, right? So it will reduce the conditioning based noise, and hopefully our home screen will reflect more focused content. And finally, impact and evaluation. We need to know what's working, what isn't, how we can continue improving. So thank you for being a part of this effort, and I'm excited that we are building it together. Thank you so much. Happy to take any questions if you have time.
Thank you so much for such a wonderful and engaging talk. We will now move on to our Q&A expert panel discussion. Please put any questions into the Q&A and I will relay them to the panelists. Joining Dr. Koratala today, we are privileged to have Drs. Kellner and Dr. Osborne. Dr. Kobe Kellner is a neonatologist, assistant professor of pediatrics, and director of neonatal POCUS at Connecticut Children's. His interests focus on neonatal POCUS research, education, and dissemination, including the use of social media platforms such as EB Neo POCUS to support evidence-based learning and global collaboration. Dr. Ashley Osborne is an assistant professor of pediatrics and director of neonatal POCUS at the Medical University of South Carolina. She has extensive social media experience, reaching over 14,400 followers on her professional Instagram, and serves as TCAN's communications chair and Neo Reviews' associate editor of social media. I would like to start the Q&A session by asking our panelist a question. Dr. Koratala, you touched on this briefly, but if the other panelists could also share their thoughts. How do you navigate patient privacy concerns when sharing POCUS clips or cases online?
Yeah, I definitely am pretty careful with that. A lot of the things that I post are mainly research based, and so as long as they have, the that common allowance 4.0 law that they kind of throw on at the end of their research, then you're allowed to use it as long as you cite. So a lot of the posts that I'll do will be through research, case reports, things like that. So I'm pretty careful, or I make the images myself.
I think the biggest thing is to be sure you're not posting any HIPAA identifiable information, but also each institution may even have stricter rules for social media posting. And I think a lot of institutions now have guidelines. So I would just make sure that you're familiar with what your institution's social media policy is. I think if you are posting any real images of patients or their families, the best thing always is to get a written consent. And then beyond, the immediately identifiable information, I just want to highlight other things that were also talked about is like the date, saying today, things like that, that a patient potentially, if they see that you posted, they could identify themselves. So you should always separate things in time and space. Like if you have a pearl, post the pearl, not the patient. And, if it happened today, maybe post it next month.
Anything else, Dr. Koratala, that you would want to add as well?
No, I think that's a really good point that most institutions have now social media policies, and when you want to do something like this at a larger level, it's always good to pitch your idea to them, the social media director or somebody, and get their views on that. Yeah.
Next question is when you first started, was there any concern of medical legal issues from your colleagues? In other words, like what if you made a wrong diagnosis with POCUS, if it wasn't your subspecialty specifically?
Oh, like, are you asking in the clinical realm or sharing on social media?
I think both.
Both in general, like when when a nephrologist scans heart, there is always some degree of apprehension about medical legal aspect, but like the key is to have hospital privileges, right? So, and hospital grants you privileges if you show some certification, some sort of minimum competence. And I had some certification, some CME hours, whatever our hospital credentialing committee wanted. And initially they gave me conditional privileges, meaning every month or every 2 months or 3 months, the POCUS committee will sit together and review some of my images. And if they find it satisfactory, that's fine. If they don't find it satisfactory, they will let me know. So there is always some checks and balances. I mean, because POCUS is not restricted to one specialty, fortunately. So even if that particular specialty doesn't have that much POCUS experience, you can always leverage experience of other specialties. That's how it generally works. And on social media, I used to share only de-identified images and I mean, if I don't know something, I wouldn't post, or I just say I don't know what it is. I just want some guidance on this, and I explicitly mention that your guidance is not affecting the patient care. I mean, if I don't know something, I obviously get consultative imaging, radiology performed or cardiology performed. I'm not going to wait for other expert on Twitter to tell me, but it's mostly for education. So that's how I specify that. How you, it's basically about how you communicate on Twitter. Yeah.
One of the reasons I started the account for myself was just I wanted to keep myself accountable to read all of these articles, and really it was just I love research, I love promoting that, and my interest is in POCUS, and so I when I hear questions like this, I usually can go back and think of research and studies that involve this, and there's actually a paper that got published many years ago looking into this exact question on using it and lawsuits. And the only time POCUS actually had a lawsuit that lost was the machine was in the unit and it wasn't used. And so it's actually the opposite. The whole argument, it's a little flawed, and we really need to know how to use it if it's going to be in the unit.
Next question. If you would start your social media presence today, in which social media platform would you start?
That's a trick question, but I would still start on Twitter or X. A lot of people have reservations about X, depending because of who owns it and how the content is being shown to people. But my bias is still using Twitter because other platforms don't have this reach. I mean, the only platform that is comparable to Twitter in the way it behaves, that is allowing tutorials and all those things, is Blue Sky. But Blue Sky has very limited set of audience, and Twitter has audience from all over the world. I mean, like compared to US population, who might care more about who owns Twitter, rest of the world doesn't care that much. So I still think like to reach a wider population, to make a huge impact on the field, Twitter is still best. But also I would say like you should be on multiple platforms and share content tailored to those platforms. I'm on Instagram too with 60,000 followers, and on LinkedIn I typically share more professional posts rather than POCUS education. Like if I go to talk about something, I just share my feelings on how the talk went, or I talk about Dunning-Kruger effect in POCUS, something like that, rather than like sharing images. So again, like be on multiple social media platforms and share content accordingly. Yeah, that's my bias.
I think a good place to start is pick a platform that you like and that you know, and then you could grow from there. So you can think about popularity too, but YouTube and Facebook, at least from the most recent data that I know of, those are still the most popular social media sites. And then Instagram was growing. And then from a neonatology perspective, I'll say, Neo Twitter was amazing, and its heyday sort of has passed. On X, there are people still there, but initially, like the med ed space was very rampant in neonatology, specifically on Twitter. And I think people have slowly migrated, and so we're a little more spread out. But I think picking one that you like and that you know is a good place to start if you're interested in engaging on social media.
Next question is, this is for all of you. How do you think social media can complement but not replace supervised scanning and neonatal POCUS training?
I'll let neonatologists answer that because it's more specific to neonatology.
I mean, I think Abhi had touched on it a little bit during the presentation, but you get these like glimpses and clips of things, and usually they're like pathology, and it's kind of fun. But that's not most of your scans. 90% of it's going to be normal. You're looking for the pathology, and like physically hands-on doing the ultrasound is difficult at first, and there's a steep learning curve. And then once you figure that out, you get better and better seeing the images. And so I don't think anything replaces actually getting to the bedside, but complementary for sure. It's a good way to, while you're scrolling or you're on Twitter, seeing something, learn a little tip, for sure.
Yeah, I agree. I think social media for learning is really cool because it sort of can reverse the trend of seeking out so much information. And, majority of Americans are on social media at least once daily. So you can actually use some of that time to your benefit. And you may see things like pop up from NephroPocus, and you take the little quiz, and it could highlight maybe some knowledge gaps, right? If you answered that question and you thought it was the IVC and it's really the aorta, then maybe that will make the learner or the engager go and dig deeper into that and actually identify some knowledge gaps and go back to maybe the textbook where they need to kind of fill in that space. But I think it's a really nice complement. And I don't have a master's in education or anything, but there's all these different parts of adult learning theory, like micro learning and the self concept, where you don't want to be imposed upon. And so using social media to that aspect, and it's more on your time, I think can be really valuable. And I think just seeing more scans, right? So being able to identify normal from abnormal. And so just seeing those images with time and space repetition is probably helpful. I don't think we know that, but I think probably it is.
Yeah, at least from my experience, it's a great complement from image interpretation standpoint. I mean, I still think like there is no other platform or there is no other resource apart from social media, more specifically Twitter, because that's what I've been on, to see that many abnormal images. You can read a textbook, but textbook is also very, I mean, very limited in scope with respect to abnormal images. I mean, there are some identified experts and who write a chapter and they get some like 4 or 5 image clips as a supplement to the chapter. But like if you're on Twitter, there are a lot of people who are not really in academic spaces, but they're like private physicians who are like primarily clinicians, and they share their experience. I think that's really valuable.
Thank you so much. Next question is, you all have some very eye-catching educational posts. Do you use any specific programs to help create your posts?
I mean, I just use I used to use primarily PowerPoint. It's nothing. It takes time, but it's worth it because like when I make a good slide, I use it for something else. Like I said, I gave like 150 talks, so it will be useful. It won't just go waste after one tweet. Um, and when sharing Vexus waveforms, I deliberately use tinted images on my ultrasound. That way I get that waveform in different tints. Some are pink, some are amber, and all those things. I just use them. I mean, there is some utility to that. Like some of the tints make the waveforms crisper, but also it just mainly to be eye pleasing. So that itself grabs a little bit of attention. And I think over the years I have found ways to like get get some good illustrations from wherever. Like now I know better like where to search for better illustrations and all that. And with the advent of AI, like I mean, you can definitely make the clay illustrations and stuff that I showed in my presentation. So they are generated based using AI. But still, I think now, because it's in early stages, like you need to know a little bit of prompting. You have to experiment a lot with generating right prompts. And sometimes I draw the images on my iPad and upload it in ChatGPT and say, make this in a illustration form or social media ready form or something without changing anatomy. So that helps. So it takes some time and effort, but I think in next few years, like they'll be so good that you just give a two-line idea and you get like eye pleasing images. I think that the content creation will get much simpler eventually.
I really liked your clay images. Another resource I really like is Canva, and it has a lot of good free templates and it's easy to use.
Yeah, I use just basic PowerPoint for a lot of mine. Try to make it as simple as possible. I have the most control over it. You should see some of the funny AI things that come in when you try to prompt it. I should post some of them. They're so bad sometimes. But yeah, doing it yourself sometimes is the best way.
You guys moved into the next question, specifically about AI and how you've incorporated AI into your social media presence and education.
Yeah, I mean, I think it's here to stay, and you should try to use it as much as possible. Being careful and knowing that you really have to have the background knowledge to know that it's wrong if it gives something wrong. So just being really careful with it. But it can help it. I mean, it speeds up things so fast, and things that take me a while to do. Sometimes it can help.
And my platform of choice is Instagram. So I'll often use AI to kind of edit my captions to make them more Instagram friendly. And with time, even AI will like learn your voice. So it'll even kind of sound like you and they'll be consistent.
Yeah, definitely. The positive aspect of AI is that it reduces your time to create content, and also it enhances the way you present your content in the ways that you previously haven't thought about. The downside is that, like, because it can create reasonably well structured content in such a limited time frame, then almost like all the posts look very similar, and using similar language or similar pattern, and people get fatigued, like especially with LinkedIn posts I see these days. Like they're really well crafted in terms of language, but like you feel like a lot of people are posting very similar content and it's generated with AI. So it's fine to use AI to modify your language because not everybody is native English speaker and stuff. So, but like using AI to generate content can be really detrimental actually to overall. I mean, to some forms of information sharing, not to everything on social media.
So sorry. Thank you, everyone. This has been a wonderful and engaging discussion. Unfortunately, we're out of time. Thank you to our speaker and panelists for sharing their expertise and dedicated time. And thank you all for joining us. Please join us next month for our monthly webinar. Registration will soon be available through our website and will also be sent out through our listserv. To receive those emails, sign up on our website. In the chat, you will see the link to the NeoPOCUS Collab website, where you can also find recordings of all our webinars. Thank you, and we will see you next month.